your voice on air. You can text 85058 or email like John has. John in Kent, you're listening to Up All Night. And he says, I was listening to the US Open last week, and the Five Live commentators mentioned about the Australian golfer Jason Day having an attack of vertigo and collapsing on the course. I always thought vertigo, you know what's coming here, don't you? I always thought vertigo was dizziness from looking down from high buildings. It was mentioned that he had a balance problem caused by a problem in the inner ear. And a fellow professional says he also had vertigo and thinks it was caused by using anti-inflammatories for various muscle problems. So quite a few things in that. First of all, it's always a debatable point, isn't it? Is vertigo only if you have dizziness on a high building, or is it purely an inner ear?
Vertigo, the textbook definition that you get at medical school, is vertigo is a sensation of rotation or movement in the absence of any movement. In other words, a person will say, the room is spinning, but I know I'm not moving. It's sometimes elicited by people going up onto tall buildings because you get this visual disturbance and you feel giddy and dizzy because you're feeling very, very scared of the height. That's not truly vertigo. It's actually that a person feels they're falling, but in fact they're not because of the height. True vertigo is where a person has a problem with their inner ear. And I mentioned at the beginning, the researchers looking at tinnitus elicited tinnitus in their mice by giving them big doses of aspirin. It's interesting that in your story, your individuals are talking about taking painkillers and anti-inflammatories for muscle aches and pains. There you go. These aspirin-like drugs probably have irritated the inner ear, which doesn't just translate sound waves into brain waves. Your inner ear also includes your vestibular system, which is a system of little pathways which register movements of your head by looking at how fluid gets left behind a little bit as your brain and body moves over the fluid, and that registers movement. If you irritate that structure, then your body's balance system, it's like a spirit level inside your head on each side effectively, that gets disturbed, and so it starts sending spurious signals into your brain telling you, oh, I'm moving, and in fact you're not moving, and so then a conflict goes on because most of your body is saying, I'm not going anywhere, but your inner ear is saying, I am going somewhere, and this argument then makes you feel giddy, it makes you feel sick, and that's partly also what seasickness is.
So the aspirin bit of that, if you have a headache and you take an aspirin, and then you feel a little bit wobbly, a little bit spinny, is that caused by the aspirin or was that caused by the headache?
Well, it could be either. You have to take very big doses of aspirin in order to get these effects, or be one of the people who are more sensitive to its effects. It was much more common, this effect, and tinnitus related to taking aspirin about 100 years ago, 50 years ago most recently, because in those days the condition rheumatic fever was much more common, and this is a inflammatory condition that can damage a range of tissues including your heart after you get infected with streptococcal infection. And there wasn't much people could do about this when it was common. It hardly happens these days. It's much, much more rare. But in those days, they used to just put people to bed, tell them not to do anything, and give them massive doses of aspirin to control the joint pains and to stop the damage to the heart. And a lot of the side effects, or a lot of the things people complained of were, I've got tinnitus, doc. When they said that, the doctors actually paradoxically knew they were treating the patient well because they knew they'd got them on about the maximum dose of aspirin they could tolerate, and they would turn the dose down very, very slightly and then run them at that dose until their rheumatic fever improved, which could take a very long time.